Good afternoon, everyone. My name is Daisy Gonzalez, and I am an undergraduate public policy student and Dean's Ambassador for the School of Public Policy at UC Riverside. Welcome to today's special online event with our guest, Lizbeth Aiblin, Deportation Defense Programs Manager for the Inland Coalition for Immigrant Justice. We will be discussing with her today the topic of COVID-19's impact on detention centers. Now, before bringing our special guest up, I will first go over the format for today's webinar. For the first part of today's online event, a panel of student discussants and I will be engaging with Ms. Abeln in a roundtable discussion. Then we will open up some time for questions from the audience at the very end. Audience members, if you have any questions you would like to pose during the Q&A session, please do not send them via chat, but rather via the Q&A feature, which you can find at the bottom of your screen. Audience members, you can submit your questions anytime throughout the event via the Q&A feature. You do not have to wait till the audience Q&A portion to do that. I will then pose audience questions to Ms. Abelin once we reach the audience Q&A. Now, it is my pleasure to introduce our special guest for today, Lizbeth Castillejos Abeln. Lizbeth is an undocumented immigrants' rights activist from Chiapas, Mexico. Her lived experience with the immigration detention and deportation system has informed local, statewide, and national strategy and policy. In her role with the Inland Coalition for Immigrant Justice, Lizbeth leads and develops support programs for people in detention and families affected by the deportation pipeline. Locally, she leads a nationally recognized campaign to shut down the Adelanto Detention Center and advocate for alternative models that center the needs of the community. Lizbeth, we are so grateful for you to be here with us today. Thank you so much.
Thank you.
At this time, I'd like to introduce my fellow classmates who will be joining our student discussion panel. Maddie Bunting, Genevieve Chacon, Arlette Flores Aparicio, and Vivek Kakar. Thank you all for participating. So Ms. Abelin, again, thank you so much for being here with us today. I wanted to first address this question and really talk about what immigration detention centers are, just for our audience to get a little perspective on what they do and kind of on what they are. So immigration detention is the process of detaining non-citizens, men, women, and families in jails or jail-like settings while their immigration case is being processed. Immigration and Customs Enforcement, which is also known as ICE, is a branch of the Homeland Security Department. And they have increasingly relied on private facilities to detain and manage immigrants, a practice that intensified under the Obama administration and extended under the Trump administration. Can you speak more on the privatization of detention centers and sort of how this whole complex system works?
Yes, well, I think it's important first to recognize that immigration detention, or the practice of detaining immigrants, is just a small piece of the entire mass incarceration issue that this country faces. And this all came to be with criminalizing ideologies and policies that are centered on white supremacy and anti-Blackness. And I think it's important to note that because in that way, when we note that and we identify that, we're able to really center our strategy and make sure that we attack it from the root of the problem, which is white supremacy. And mass incarceration is a practice of detaining and incarcerating people here in the US. And this is a massive problem that we face. And it's another way also to marginalize people of color, right? And to keep people oppressed. And I think immigration detention is such a phenomenon now, and it's the center of many talks, right? And many debates in the US, especially in this past election. And the practice of detaining immigrants has been privatized, and these private corporations like Geo Group lobby and also give money, massive amounts of money, to campaigns like we saw with Donald Trump, right? The Geo Group and CoreCivic, being the largest private prison corporations, have found a way to secure contracts with the federal government. And how they make money is by lowering their costs and profiting off of every person that's detained in their centers, which is very disturbing because human lives are not commodities, and we should move away from this practice. And I think the Biden administration has made this promise, and we will hold them accountable, like we were stating before.
Thank you so much for just giving us a little bit more on perspective on how this all really works and how it all comes to be. I'd like to now hand it off to Maddie for the next question.
Thanks, Daisy. So prior to the pandemic, there have been reports and news stories displaying the conditions inside detention centers, including overcrowding and unsanitary conditions. Many of the detained immigrants also don't have legal representation to fight how they are treated. Can you go more in depth into some of these conditions? Are there any regulations or standards for some of these harsh conditions?
Yes, so something very important to know is that ICE regulates their own standards. So it's very difficult to get reports from these detention centers, accurate and transparent reports. It's very difficult, but we have seen quite a bit of reports, even from DHS, in unexpected visits where they found inadequate access to medical care. They found even suicide attempts because the conditions were so horrible. The lack of access to attorneys, like you mentioned, and unsanitary conditions. So these conditions have made it super difficult, especially right now during the pandemic, for people detained to even survive. And it's very sad to hear about the deaths that have happened. But I want to highlight in ACLU's lawsuit recently, Hernandez Roman versus ICE, a DHS expert, Dr. Robert Griffinger, who is a physician for over 30 years, he did mention how the only solution to mitigate the effects of COVID-19 would be to release people, because in detention centers, there's no way to social distance. The way that these detention centers are formatted, people are crowded into dorms. There's no way to social distance. People inside use communal spaces, right? They don't have adequate cleaning supplies. There's really no way to get away from this pandemic and COVID-19. If there was an outbreak inside, it's an enclosed space. And so this expert has called detention centers like the Adelanto detention centers COVID-19 tinderboxes, which I think really sets the tone for what these detention centers are even before the pandemic.
Thank you. Up next is Genevieve.
Yeah, thank you, Daisy. And I just want to continue off what we were saying right now. I just remember seeing videos of immigrants, even before the pandemic. There's like footage that was taken secretly from these detention centers, and immigrants going up, or detainees going up to the glass doors and saying, trying to muffle through the door, "We have not been given showers. Have been in the light. The lights have been on for 24 hours. We cannot sleep. Like, we have not been able to get access to resources or help." And so I cannot imagine how much worse conditions have gotten during the pandemic. And just to continue on for my question, there's been a large increase of COVID cases, specifically in the Adelanto Detention Center in San Bernardino. There's been the largest outbreak, peaking at 146 immigrant detainees being infected last October. And just recently, it has been reported that 116 residents and 46 staff have been infected with COVID-19. And I know you're saying there hasn't been enough, like the only way to really stop the spread of infection is to really let people out. But what has been the current like policies in these detention centers, or what have they tried to do to mitigate impacts of COVID-19?
Yeah, so like I mentioned before, ICE is super secretive. It's really hard to get information, and they also lie. And I really want to note that in the recent lawsuit that I mentioned, the judge ordered releases because of this same reason, that the only way for people to social distance is to have enough space. And even then, it's really hard to follow any CDC protocols. But in this lawsuit, when he gave his orders, he did note that the government's dishonesty was causing harm to people detained, and people, even though they are undocumented, they still are human lives, and under our constitution they deserve to have access to health and deserve to live, right, and not die because of COVID-19. And in these detention centers, we see that ICE was trying to mitigate the COVID-19 effects. People inside were demanding protective gear. They were not giving enough masks, not enough masks for people to be able to use them and change them regularly. They didn't have gloves. They did have hand sanitizer stations, but it would run out and they would take a long time to fill them up again. And these are reports that we were hearing from people inside when they were calling us. They were telling us that there wasn't enough masks, there wasn't enough hand sanitizer. And the most concerning thing was that the staff was going in and out of the facility during their lunches and mingling amongst themselves outside without any mask, and then coming inside and dealing with people inside. So that just gives us an idea of what really was happening and how there was really no protocols, right? Even though they were saying that there was protocols. And one thing that stands out that happened in the Adelanto Detention Center is that people were asking for the adequate supplies to be able to clean so that they can stop the spread of the coronavirus. They only had shampoo and water to clean the facility. And so they began a hunger strike, and ICE responded to this hunger strike by using toxic chemical. And that chemical is called HDQ. One of the whistleblowers, Jose Marcos Topete, which is here with us today, and will be sharing a little bit of his testimony. He did share with us some of these complaints. We gathered enough complaints and submitted a federal complaint to DHS about this chemical, because this chemical was causing people to have physical effects like burning eyes, bloody noses. And so this is just an example on how ICE mitigates the effects. It's not really mitigating, is always retaliatory. They never have the adequate care for people, right? And the only way, like I mentioned before, that we would be able to mitigate the outbreaks, what is and what wasn't is to release people from detention centers. Yeah, so I do think that ICE didn't do enough, and the COVID situation was out of their control more than 2 times, right? There was more than 2 outbreaks from what we hear from people inside. So very concerning. And again, we do believe that the only way to mitigate COVID-19 and the spread and the outbreaks is to release people from detention.
Thank you, Ms. Aiblin, for sharing that. Yes, oftentimes we don't hear these stories about what's actually happening, right? Unless we speak to the individuals inside detention centers. So thank you for providing us some more information and sort of a snapshot of what's really going on inside. Next, we have a question from Arlette.
I wanted to bring up a question also about another group, a vulnerable group, especially the children. So the lack of management organization with detention centers obviously has a national and local concern, and we've seen this, including children being misplaced and unaccounted for and physically assaulted. In 2020, 21 people died while in the detention center due to what has been described by detractors as ICE being unresponsive and slow. My question is, so what are some ways these problems have been amplified, I guess, since the start of the pandemic? I know you were talking a little bit about that, but in response to children, we've seen that in 2018 and other things. So if you can just give us an update and about that specific group.
Yeah, so we've seen the horrible policies that the previous president implemented, the separation of families. And obviously COVID-19 really exacerbated many of the issues that were happening. And on top of abuse, sexual and physical abuse and mistreatment, we had the risk of getting COVID-19. And in these detention centers, including children, face a lot of medical issues that they have because of their journey here, right? These kids go through very traumatic experiences in their journeys here, and then are met with horrible conditions in these detention centers and camps. And so the COVID-19 really was another layer, right, of uncertainty, of danger for these folks. And although COVID-19, we saw the statistics of it not like hitting children harder or more than adults, it still was a very a very big concern that could lead to death and could be very fatal for children, right? And now with the Biden administration, we want to push the Biden administration to reunify these families and to prioritize children so that we can see the reunification of families. I think for the most part, we saw that ICE and DHS were moving to create more detention centers. Luckily, I do think that COVID-19 kind of slowed that process, but as we've seen recently, they have reopened a children's detention center. So that's really concerning. And again, we're still in the middle of a pandemic. So it is time that we close these children's detention centers and prioritize the health of children.
Definitely. Our next question comes from Vivek.
Hi, thank you so much for answering our questions today. My question has to do with the cleaning and disinfecting, especially with COVID-19. I know you touched on it a little bit, but the Adelanto Detention Center has reportedly used a chemical called HDQ neutral to disinfect the facility. HDQ is a disinfecting product which is supposed to be sprayed outdoors in a ventilated setting where it cannot be inhaled. Can you tell us about how the Adelanto Center has mistreated this chemical, and how it, can you expand a little bit more on how it affects the health of those that are detained?
Yes, so like I mentioned, already there wasn't the necessary cleaning supplies to clean regularly to mitigate the COVID-19 spread of COVID-19. And the way that ICE answered the demands of these people that were detained inside was to use this toxic chemical. And it is toxic because it caused all these physical effects. Like I said, burning eyes, bloody noses, headaches. At one point, we even got a picture of someone that had a rash, a skin rash, burning of the skin, burning of the scalp. And this chemical was used so severely. It was sprayed every 30 minutes, every 20 to 30 minutes on all surfaces. So we did receive the reports from people inside that when they would like grab door handles, their skin would get irritated. And all of this was used in enclosed space. Even more concerning was that people weren't allowed to leave their dorms. So they were in an enclosed space in their dorms for 23 hours in a day. They were only allowed to leave 30 minutes every day to shower and to make a call. I mean, the conditions were really horrible, and this spray was just another layer again on top of COVID-19, on top of the abuse that was already happening. Another layer of abuse, of mistreatment. We did work with our partners to make sure that we put out the information about what HDQ neutral is and the effects, the long-term effects. We did get congressional members like here locally in our region, Congressman Mark Takano, to lead a letter inquiring to DHS and ICE about this chemical and what was being done. ICE did respond and said that they had been using this chemical for a very long time. However, experts have said that it should not be used that often and without being diluted. So we're still, now that some people have been released from detention, they still tell us about the long-term effects that this chemical has had. So and this was not only happening here in Adelanto, but throughout the nation. We saw in different detention centers like Glades in Florida. We also saw some folks reporting in Arizona. So it's a common practice. Some people have even compared it to the use of chemicals and gassing in our history, right? In American history and in different countries as well, like the gassing of Jews listen, it might be extreme, but if we're really thinking about it, they are in enclosed space, people are suffering, and we really wanted this chemical to for ICE to stop using this chemical. I think they have stopped using it so regularly, but it still continues. And again, it not only affected them, affected folks while they were detained, but it's long-lasting effects. So I do feel that it's a form of retaliation instead of a form to mitigate COVID-19.
Definitely, as you mentioned, right? The long-term effects, they're lasting. So yes, although ICE has stopped using this chemical and sort of mistreating them inside, it still has physical, mental effects afterwards, which carries on with them basically throughout their lives. So thank you for providing us a little bit more information on that. We have another question from Andrea.
Hi, Lizbeth. It kind of like what you were saying right now, it kind of echoes what was said in the chat that says sometimes it seems that cruelty is the point. And it seems like it has been throughout this pandemic that way. But I do have a question in regards to children's, which you somewhat touched upon it earlier. But my question to you is, so in July 2020, a court order mandated ICE to release immigrant children because of the health risk posed by COVID-19. However, more than 2 weeks after the initial requirement, there were at least 120 children still in detention centers. Those immigrant children who have been released have been separated from their families. Can you speak more on the compounding impacts that the separation practices and the COVID-19 pandemic have had on immigrant children's mental and physical health?
Yeah, so I mean, it's when I talk about it, I do get emotional because it's such a horrible situation for a child to be in, and for adults as well. But I can just imagine what it is for a child. And I recently had a baby, and I can't even imagine what I would go through if that were to happen to me. And I mean, the situation is just horrible. And we did see like reports of children that were reunited with their parents that had long-lasting mental health effects, and even some were offered long-term therapy to be able to recuperate from this, or make sure that they were at a place where they were able to bond with their parent. And that's the most sad part, right? That they lost the sense of attachment to their parents. This, I mean, it's just a horrible situation. And on top of that, we saw multiple reports of sexual abuse inside these detention centers. ProPublica is a very good news source that covered this. So I encourage folks to look into that. But I mean, I don't know how much I can say, but that this practice of detaining people, specifically children, is so cruel and inhumane, and it is time that we end this practice. And you know, by the Biden administration being Democratic or progressive, this is the test, right? If we're able to end this practice, this is a new beginning, right? If we're not, like we've seen that they've opened a new detention center for children, that's concerning because of all the things mentioned before. But yeah, I mean, there's multiple reports that I can share afterwards too about the long-lasting mental health effects on children, and it's really devastating for families, communities, whole regions actually, and even when they're brought to sponsors, there's so much work that goes into making sure that the child is okay. But the best thing that this government can do, and the Biden administration can do, is to close down these children detention centers and reunite children with their families.
Thank you for sharing that. Yeah, these conversations are not easy, especially when you involve children, right? And some of the experiences. I mean, young children, that's kind of what we're talking about here. I mean, I have two little sisters. I can only imagine, right? The long-term effects, the mistreatment of what happens. But I think that even though they're not easy conversations, they're definitely we need to have these conversations to raise that attention and raise that awareness of what's going on when we separate children. So thank you again, Ms. Abeln, for sharing that. I would like to take this moment in the middle of our student panel discussion to remind the audience to please go ahead and type in any questions that you may have via the Q&A feature below. I will pose your questions to Ms. Abeln until we reach the audience Q&A portion. I do have the next question for you, Ms. Abeln. There are those who say that ICE's reporting on the spread of COVID-19 has actually been insufficient in understanding the true scope inside detention centers. I know that you had mentioned this in the past, but for example, there have been reports that ICE has removed several facilities with previously confirmed cases from its COVID-19 webpage with no explanation, really. And this ranges from facilities in Florida to California. Are there any clear or structural plans from the Department of Homeland Security for monitoring COVID-19 and conducting tests at every facility?
So yeah, this is a concern that we've all had, right? The underreporting, the lack of transparency. It's a pattern that we see with ICE. ICE is a rogue agency that not even Congress has been able to crack. And I think that's really concerning, and it's a threat to our democracy, it's a threat to human lives. With COVID-19, we saw that ICE was not accurately reporting, and daily the numbers have been modified, and there has been no explanation for the increases and decreases in the number of cases. Actually, a very good tool to use is by the Vera Institute for Justice. They actually do an analysis on the COVID-19 cases, and I just think it's completely ridiculous that we have to have our own tools to be able to do an analysis. The government should be reporting accurately, but as we've seen, they have not. And the COVID-19 cases in Adelanto, if we look at the website, they have been modified, right? They're not accurate. It does not reflect the 2 outbreaks that happened. Another concerning thing is that Geo Group, because they are a private corporation, they don't report who in their staff has gotten COVID-19. And so we really don't know the actual scope and numbers. But I do want to highlight the tools that organizations like Vera Institute and Freedom for Immigrants have made and developed to be able to track this. And I think that's where our legislators need to come in, our state legislators and federal legislators, and holding ICE accountable and creating these tools to be able to track COVID-19 and the abuses happening inside. So definitely, there's more work to be done, and it's something that advocates have been saying and telling the Biden administration to do. At best, the best thing we've been able to do when it comes to accountability is to sue ICE, right? When we sue ICE, we're able to get documents from ICE, and that's where we've learned a lot of what I spoke about the conditions, about ICE lying. That's where we learned through the lawsuits. But even with the lawsuits, I mean, we're still seeing increases in cases. We're still seeing abuse. Again, ICE is a rogue agency that needs to be dismantled because they are a threat to human lives. And if we as a nation want to display ourselves as a democracy, this is not democratic at all. And it does not center the needs of Americans and of people that build this country, of people of color. And so like I was saying, ICE is just not transparent. There's no accountability, and our federal and state legislators need to do more to keep track of what's been going on.
Thank you. We have a quick comment from Andrea. She wanted to mention something.
Lizbeth, I think you had mentioned earlier about ProPublica, the articles that they report on detention centers. I'm gonna link some in the chat. I found some that are, I think one is titled ICE Guards Systematically Sexually Assault Detainees in El Paso Detention Center. And there's another one on It says, listen to children who've just been separated from their parents at the borders. So if anyone is interested, I'll link those. And I think it'll go really well with what you're sharing with us.
Thank you, Andrea.
Thank you for sharing that information, Andrea. We have a next question, comes from Maddie.
Yeah, so historically, the United States has relied heavily on incarceration as its primary method managing migration. However, many Congress members have called on Congress to phase out detention centers, as you've been talking about, due to what they call inhumane and unjust practices inside these centers. What are some short-term and long-term alternatives to immigration detention centers that the federal government can implement?
Yes, so I love this question because it brings us to our vision of not having prisons or detention centers. What we really envision for our communities is more investment in community-based programs. And one of the reasons why we do advocacy to shut down these centers is because we want space for our community to really show how we care for immigrants and to care for each other. We do this through mutual aid, right? And I will speak on some of the other ways that we do this. But I wanted to highlight our effort to pass AB 32, which is the bill to ban private prisons. We were able to pass this with community support, and we really made the point to legislators that we don't need private prisons in our state, and there are alternatives that are more humane. There are alternatives that do not profit off of people's misery. And in our region, I just want to highlight some of the work that ICIJ has been doing. We have an emergency response network that is led by volunteers and directly impacted people to respond to ICE activity in our region. This network has been very crucial to supporting people in our community that has been affected. And we also have campaigns like the Shutdown Adelanto campaign that has done the work to make sure that we have support programs for people inside detention centers. We've supported with bonds, with mutual aid, and recently with the judge's orders to release people from detention centers, we created a community-based system to be able to welcome them that included housing, transportation. And so I do think that this federal government has the sufficient means to be able to allocate funds to community organizations like ICIJ, like other organizations doing the work to lead on this model of centering the needs of immigrants in our communities and causing no harm to people, to our community. And unlike the detention centers, right, that are only there to give profit to entities like ICE and private prison corporations, and really these detention centers disregard human lives. And so by centering the needs of people directly impacted and letting community organizations lead, and community leaders and people directly impacted, we're able to create a sustainable and healthy way of integrating immigrants in our communities. So it is possible. We did see it recently with the release of over 400 people. We successfully reunited them with their families. We provided housing, transportation, food. When CBP also was dropping off people here in the city of San Bernardino, we reunited over 500 families with their loved ones throughout the nation, and we were able to do that without anyone dying like we see in ICE facilities, right? That the threat of people dying, especially during COVID-19. And so it is possible. Another world is possible. And that's why we're here, right? To make sure that we push for that and to push our legislators to invest in our communities and divest from cages.
Thank you. Genevieve has our final question for the student panel discussion. Genevieve?
Yeah, thank you, Daisy and Lizbeth. It makes me so happy to hear that AB 32 passed and you have and your team has successfully reunited people, like you said, without any casualties, or just being able to do it with in a humane way, a way that focuses on the community rather than just on punishment and separation. So it makes me very happy to hear that there is progress being made. But unfortunately, there is still a large increase in the opening of detention centers. According to a report done by the American Civil Liberties Union, 40 new detention facilities opened in 2017, and a majority of those being run by private operators. And the number of detained immigrants kept in privately owned facilities has jumped to 91%, creating challenges for immigrant detainees to access resources. In your opinion, what kind of immigration policy should the Biden administration prioritize in regards to the expansion and privatization of detention centers?
Yes, thanks for your question. We are part of a national coordinated strategy to end detention in the nation as a whole. What we are doing first is to ask the Biden administration to close down 10 facilities, most of those being family detention centers. And it also includes Adelanto and Mesa Verde here in California, because ICE and GEO have circumvented AB 32 and found a way to expand. And this is really concerning because we're in the middle of a pandemic. The cases are only increasing, and yet ICE somehow more than a month ago has found a way to increase their capacity to additional 750 beds in the city of Adelanto using an annex facility. And even though, you know, the judges have said you need to reduce your population, experts have said you need to find a way that people can social distance, they're increasing their capacity. So that proves to us that long term, they're setting themselves up to have more capacity to detain people, even though their numbers right now at our low number, historic low. So I do feel that the Biden administration needs to start with these 10 facilities. And I can definitely link the campaign in the chat, or I can send it to Daisy afterwards to share with folks. But starting with these 10 facilities can really set a precedent of what is possible here. And the Biden administration has the power to stop deportations, to end the contracts with these facilities. We also need legislation to cut the funding to DHS, because the more funding that we have given to ICE and CBP, the more detention centers we see, the more enforcement in our community. So definitely the campaign to defund hate and cut funding is definitely a really important one that the Biden administration should prioritize. But there's also legislation being brought forth to end criminalization of immigrants through in 1996, right, we passed the Nationality Act, and different clauses definitely did shape immigration detention that we have today through quotas. Yeah, all of that is really important, and that's another piece of legislation that we should support to end the criminalizing side of being an immigrant and seeking a life here in the U.S. As we've seen with the Trump administration, the problem really wasn't about legality, because when asylum seekers exercise when people seeking asylum exercise their right to asylum, they were attacked, right? And when people that have been here that have undocumented parents and were called anchor babies, sorry for the term, right, they were attacked as well. So we saw that it was not about legality or not, because people were seeking legal forms, and yet we're still being criminalized. So we do need to end those criminalizing policies and make sure that we acknowledge white supremacy, right? That informs these policies. But yeah, in summary, I do think the Biden administration should focus on defunding DHS. I do think that the Biden administration should focus on ending criminalizing policies and stopping deportations, right? That's a big one. But we do hope through our campaign, Communities Not Cages, that the Biden administration is able to close down these facilities and make sure we're taking a step in the right direction.
Yeah, definitely. I think just going back a little bit, the rhetoric from the previous administration brought up a lot of anti-immigrant sentiment instead of, it wasn't legality, it wasn't, like you said, it was just more like, we don't want immigrants specifically from Latin America because they bring crime or they're criminals. And again, and it's that sentiment of criminalizing Latin American immigrants that has allowed the detention centers to be seen as okay because, oh, they're lawbreakers, they're criminals, they shouldn't even be trying to come in here. But again, it's the entire system that has been founded on white supremacy, on disrupting the migrant pathways that have been in place for hundreds of years, that just putting in these laws that criminalize the normal flow of migration that has always been in this country. And so definitely, I think going at the root of the problem and just seeing that treating them as criminals is not actually helping them, and putting them in detention centers is not going to bring down the levels of immigration. So I just definitely think going forth and helping the communities instead of putting them in cages is definitely the way to go. So I just want to thank you for giving us that information. Yeah.
Yeah, and I want to uplift Black lives in immigration. I often feel that we center the narrative of Latinos only or Latinx folks only being immigrants. But right now, with Biden's administration, we've seen that Haitian Black immigrants and other Black immigrants have been prioritized for deportation. So again, we go back to the fact that these detention centers is part of mass incarceration, is part of continuing white supremacy and anti-Blackness, right? And when we finally see the end to this, that's when we will see our vision come to life of having communities without prisons, without cages, and the government divesting from this and investing in our communities, and really going away, like pushing away from punitive systems and focusing on relief. And this is what the Biden administration should be doing, focusing on relief, on making sure that we're not criminalizing, but instead providing different forms of relief for immigrants that are here and that are coming here.
Yeah, and just as a quick follow-up, as we're talking about current relief, immigrants in detention centers are currently being impacted by COVID-19. So just to reiterate, what should the Biden administration focus on right now to help these immigrants currently in these detention centers for COVID-19? Mm-hmm.
Sorry, I couldn't hear the last part. Can you repeat?
Oh, I'm so sorry. So I just wanted to ask you, what should the Biden administration do for the immigrants that are currently in the detention centers to make sure that they will be safe, even if we cannot necessarily close down the detention centers right now, but what can we do to ensure that they are safe?
Yeah, I feel like the first step is identifying those that are high risk of COVID-19, vulnerable populations, according to the CDC, and continue releasing people, and those and people that have been that are in detention centers that don't meet the enforcement priorities, which means those that do not have aggravated felonies should be prioritized for release. So the Biden administration should continue pushing ICE to release these people, to reduce the number of people in detention so that people can follow CDC guidelines, social distancing. Also, one big issue that we're seeing right now is that people in detention are not being prioritized for the vaccines, and they are a population that is higher risk of getting COVID-19, so they should be prioritized. So the Biden administration should prioritize giving funding and giving vaccines to people in detention and prisons. And this responsibility is also to our state and to public health departments. So just wanted to highlight that too.
Thank you so much, Ms. Aiblin, again for answering all our student panel questions. At this time, we will now open it up for questions from our audience, and we have quite a few, so let's go ahead and get to these questions. Our first question comes from one of our attendees. This person asked, is there any way we can donate supplies such as masks and hand sanitizer to detention centers?
ICE actually does not allow any donations, no matter if we try. So like I've said before, we've set up systems of mutual aid, and we're setting up different locations to have storage in case of an emergency, in case we need to support people, in case we get asylum seekers from the border. And so if you would like to donate, or know anyone that would like to donate, you can go ahead and email info@ic4ij.org, and we will gladly receive those donations. So thank you for that.
Thank you for giving us, a resource where we can actually be able to, give, whatever we can, resources, right? Anything that really helps these communities. Just to add another question from our attendee, kind of what we were discussing about a little bit before. Our attendee asks, do you think the Biden administration will do anything at all? He does plan to reopen the Homestead Detention Center for children. And he stated he was going to stop deportation during his 100 days, yet the numbers of deportation are going up now. Do you think the Biden administration will, take action and do anything to mitigate some of these issues going on right now?
I mean, I am hopeful, but like we've been mentioning, this is a system that's very deeply rooted in white supremacy. So there's a lot of work that needs to be done to undo and mainly to abolish this system of incarcerating people. But I am hopeful that Biden will move towards the path of doing away with detention centers and incarcerating children and families. But if it does happen, I just want to acknowledge that it's because of the work of the community and community organizers and advocates have been advocating for this for a very long time. But more work needs to be done to pressure the Biden administration. And I hope that everyone that's hearing can join us in this movement.
Thank you. We do have a question actually from Arlette. I don't know, Arlette, do you want to pose your question for Lizbeth?
Yeah, my question is about the support from legislatures in California. How was your communication with them, specifically in the Inland Empire, and within coalitions? Like, I know Inland Coalition of Immigrant Justice, but do you partner with other, like the ACLU, in trying to create these interest groups to push the legislation even more than you want it to be, when it's like, I guess what I'm trying to say is, like, a bigger group is more power. And so how is that pressure when it comes to try to persuade legislators? Yeah.
Yeah, so locally, like I've been mentioning, we have the Shutdown Adelanto campaign, or the Shutdown Adelanto coalition, and we do meet regularly, and we come up with strategy, right, to end detention in our region, or to shut down the Adelanto Detention Center. ACLU is one of our partners. We have many strong partners from not only the IE, but LA and OC. So that's very exciting that we've, especially during this pandemic, has really brought us together to advocate for folks inside Adelanto. Statewide, I want to give a shout out to Dignity Not Detention. Is a coalition that has been passing legislation like SB 29 and AB 32 to end the practice of detaining immigrants in California. But here locally, I'm happy to say that Congressman Mark Takano and Congresswoman Norma Torres has hopped on into this campaign, Communities Not Cages, and has publicly said that we do need to shut down facilities like Adelanto. So that's very exciting. But again, there's more work to be done in terms of accountability. We can say many things, but at the end of the day, ICE continues to get away with many things, including a recent expansion of their facility. So a lot of work around accountability needs to be done. And the Shutdown Adelanto Coalition and ICIJ, we are meeting with legislators to see how they can support. And I just wanted to uplift some policies that we have going on and that we will be supporting. One of them is the Vision Act, which ends the transfers of people in prisons to immigration detention. That's something that increases the spread of COVID, right? Transferring people from jails and detention centers. It's also double punishment for some folks, right? That are losing their status. And so the Vision Act is something that has been introduced by Senator Durazo. And then we do have another piece of legislation that has been introduced in January called the Hold Act, which will give public health departments more authority to give reports to facilities like Adelanto, because the Adelanto Detention Center is in San Bernardino County. And so the county should be involved in making sure that COVID-19 is not spreading. It not only affects people detained, but the workers, right? The community of Adelanto, and then far beyond that. So the Hold Act is a piece of legislation that we're supporting. We're supporting immigrant defense advocates in pushing this bill. And I believe the bill is AB 263, and Assembly Rob Bonta introduced it in January. So there's definitely a lot of work being done. I do just want to acknowledge that we really want to acknowledge the work of the community, because if it wasn't for the community, we wouldn't have policies and legislation like these. So yeah, the real champions are people that are directly impacted, that have put their lives on the line for many years, that have advocated for themselves, for the liberation of themselves and others. So want to acknowledge that, but also it's super important to continue advocating for policies like I mentioned before. Thank you.
Thank you so much for that question, Erla, and thank you again, Ms. Aiblin. At this time, actually, kind of want to redirect everyone's attention. We do have another special guest with us today. Fortunately, we were able to bring him on, so I'm so grateful that we were able to all work all the kinks out. But thank you for being here with us, Jose Marcos Topote. He is a Mexican immigrant who was detained in the Adelanto Detention Center for over 2 years. And was released after a federal judge ordered a reduction in population amidst COVID-19 breaks. Thank you for joining with us today, Jose, to just tell us more about your experience, your journey, and kind of, being vulnerable and open to us about what's going on inside these centers. So thank you for being here with us today. Gracias por estar aquí.
Muchas gracias por su invitación. Pues, ¿sí me oyen? ¿Sí me escuchan?
Sí, te oímos. And Lizbeth will also serve as a translator for those who may not understand Spanish. So thank you.
Pues les voy a contar un poco de los sufrimientos que pasan adentro de la detención, principal adentro de la detención de Adelanto. Es mucho abuso, mucho crueldad, incluyendo ahora que se vino el contagio del coronavirus, que nunca tomaron precaución a la detención de Adelanto, incluyendo ICE.
I want to give today a testimony of all the sufferings that immigrants go through in detention centers, in particular the Adelanto Detention Center, and recently with COVID-19, and how ICE did not follow any of the protocols for COVID-19.
Y también les quiero dejar saber que en esa detención, en todas las detenciones, hay mucha gente de todo el mundo. No nomás sabemos mexicanos, hay de muchos países que no pueden ni comunicarse con el lenguaje porque además hablan su propio idioma. Y ahí adentro de la detención de Adelanto hay mucha discriminación. No se tomó precaución con el contagio, no hallaba ni qué hacer cuando explotó el contagio del coronavirus adentro, no sabía ni qué hacer. El departamento médico de la detención, incluyendo ICE. So, hubo el contagio, lo que hizo ICE, se alejaron de la detención. Nunca llegaron a hablar con nosotros qué estaba pasando, qué ocupamos, nunca tomaron precaución ellos, como que no les importó.
So I want to give a snapshot of detention centers like Adelanto. It's not only Mexicans being detained, but it's people from all over the world that speak different languages. So the language barrier definitely made it more difficult, especially during COVID-19. But in specific ICE during the coronavirus, they were not able to control the outbreaks. And even worse, when the outbreaks were happening in Adelanto, they stayed away in fear of getting COVID. They did not provide education about COVID-19 to immigrants like Jose.
Ahora nos estaban echando un químico, según el químico, el HDQ, para matar según la infección del coronavirus. Y ese químico no le hizo nada al coronavirus. El químico nos dañó. Personalmente a mí me dañó junto con mis compañeros que estábamos adentro. Nos estuvieron echando, fumigando con ese químico. ¿Y qué pasó? Se les salió de control. Explotó adentro el coronavirus. No había ni qué hacer. No había ni para dónde correr los doctores, las enfermeras. No había ni qué hacer.
During the pandemic, they in order to mitigate the effects of the pandemic, they started spraying a toxic chemical called HDQ. But what we saw is that it only resulted in the physical harm of people detained through bloody noses and just overall physical harm. It didn't actually help stop the spread because the outbreak still happened, and the staff inside, the medical staff, didn't know what to do. Everything was out of control.
Ahora nos dejaban encerrados en los cuartos, sin acceso de agarrar agua para tomar agua, ni poder usar los teléfonos, ni podernos bañar. Si nos bañamos en el baño, habíamos como unos 70 personas con el baño todo cochino. Ahí se necesitaba limpieza. Nunca se nos dio la limpieza que nos tenían que haber dado.
There was never professional cleaning of the facility. They were on lockdown for most of the day. And when they went out to take showers, it was around 50, 60, 70 people trying to shower in very unsanitary conditions without the proper sanitary facilities to be able to shower.
Y nos daban 30 minutos para salir del cuarto, para bañarnos, para agarrar agua, y para calentar el microwave y para poder hablar, como tuviéramos tiempo para hablar con nuestra familia, por 30 minutos.
They would give us only 30 minutes to drink water, to shower, to heat up food, and to call our family members. 30 minutes wasn't enough for us to be able to do what we had to do.
Y ahora un juez federal de Los Ángeles, de la Corte Federal, les ordenó al Departamento de GIO, incluyendo a ICE, que se limpiaran las 24 horas, se desinfectaran los baños, los cuartos. Nunca se ha obedecido la orden del juez.
So a federal judge ordered ICE to follow protocols and to sanitize the facility, but I can tell you guys that, or you all, that that never happened. ICE and GIO did not follow the protocols for keeping the facility sanitized.
Es mucho abuso que pasa dentro de la detención, mucho abuso a puertas cerradas, que no quieren que salga eso a reducir para afuera. Pero gracias a la organización de la Justicia para Inmigrantes, donde está Lizbeth, que ellos todo el tiempo han estado peleando por toda la gente, por todos nosotros, hacen un trabajo que no hay palabras para decirles gracias a ellos, ¿me entiende? Y por eso la mayoría de todos mis compañeros estamos afuera. Gracias por la organización de Lizbeth.
And a lot of abuse happens in closed doors. He can say many, many stories, but he's thankful that he's now out thanks to the efforts of ICIJ and many others. Him and a lot of his friends were able to be released and able to speak out regarding this issue. Gracias, Jose.
Thank you, Jose. Gracias por estar aquí, for being here, compartir su experiencia, su historia, to share your experience, to share your story. Sé que es difícil. It's hard. It's really, really hard to share, some of the things that you went through. Pero gracias para levantar la conciencia de lo que está pasando, to raise awareness of what's going on, and Y gracias por estar aquí. Thank you for being here.
Gracias por su invitación.
Gracias, Jose.
Gracias.
Thank you so much, Lizbeth, for again inviting him. We really appreciate it, and just sharing, a personal story of what's going on. I mean, this is someone that came from that detention center, can personally explain what did happen to him and what's happening to other communities. So moving forward, we do have a couple more questions from our attendees at this event. One of the questions comes from an anonymous attendee. They are asking which efforts can be made to locate the children that have gone missing in detention centers.
Yeah, in terms of specific, it's really hard to say, but like I mentioned before, lawsuits are a really good way to mandate that the government or other entities like ICE take action. But not only through lawsuits and having mandates, but having real consequences when that is not met. And I think that's what's missing, right? So that is one effort that can be made. I know attorneys have been a large piece in this puzzle of finding children and their parents and reuniting them. So definitely supporting attorneys as they're doing this work. And I'm not sure if this has been explored, but federal legislation would also be a means to mitigate all the effects or all the harm that has been done with children being separated. But I would say the best way to be involved in this effort would be to contact your congressional member. They have the power to question ICE. They have the power to put forth legislation, even to sue. So I would say that's the best way. You can Google your congressional member, send them an email, or set up a time to meet. And me and my colleagues are happy to join those meetings and to push your congressional member to advocate for children and people in detention centers.
Thank you so much. And just to quickly follow up with that, because I think it sort of relates, to some of the ways that we can, get involved. One of our attendees, Michael Martinez, asks, what are some things that community members can do to help support these people in the detention centers? I know calling, right, following up with our representatives, our congressional leaders is one way. Are there any other ways that community members can get involved as well?
Yes, that's a great question. So we do have the emergency response network that I mentioned. A lot of it has to do with responding to ICE enforcement in our communities, but we've added an additional program now to support people inside detention centers through, I know right now we're in COVID-19, so we can't visit, but prior to COVID-19, we were visiting people in detention, really breaking the isolation that these folks face, listening to their stories, and then connecting them to organizations that can support with their cases. But visiting, writing letters, becoming a pen pal is a good way. Donating for their commissary fund. Sometimes they're buying commissary is the only way that they can access good food or even medication. And then also donating to bond funds like the Inland Empire Immigration Bond Fund and the Haitian Bridge Alliance Bond Fund that we always uplift to help people inside of Adelanto. So those are some concrete ways. If it's permitted, I can link it on the chat, or maybe I can send it to you, Daisy, the link to become an ERN volunteer, a first responder. And in that way, you're able to really support people that have been impacted by detention.
Thank you. Yeah, you can send it my way, or if you are able to put in the chat, that works perfectly fine as well, just for our audience members to be able to get those resources. But I did want to give them the attention to Maddie. I know she did have a question earlier that she wanted to ask.
Yes, I'm just wondering if you have any thoughts on internationally, how maybe there can be collaboration or outreach from the United States. I mean, it's a tragedy what's going on, and it involves other countries as well with deportation. So I'm just curious if you've been involved in any work with that, or if even within California or the United States, if there's any work being done.
Yeah, so when the situation happened with the usage of toxic chemicals, actually, the Mexican government did reach out and inquire more about the situation. But the other countries are very limited in what they can do. I would say one way that other countries can get involved is through their United States embassies. Usually when people get detained and deported, embassies are alerted about the person if they are from a particular country. And just the example that I can give is Jose Marcos Sopete, when he spoke about the toxic chemicals. ICE expedited his removal. So he was actually already on a bus about to be removed, but our community emailed the ICE officers. We made a lot of noise, and somehow he was removed from the bus and stayed in the detention center a little longer. We were in communication with the Mexican embassy here in San Bernardino. So having good connections to the embassy is a good way to advocate for people's releases. Just wanted to give maybe a quick minute for Jose to mention that piece of him almost getting deported. José, ¿quieres compartir sobre cómo cuando hablaste de los químicos te quisieron deportar más rápido y tu experiencia?
Sí, cada vez que, pues cada vez, como ellos dicen que estuvieron usando ese químico por 10 años, pero nunca hubo nadie que lo reportara ese químico o los amenazaban. Soy yo cuando comencé a mirar todos los abusos que están pasando, incluyendo con el químico eso, miraron que estaba levantando a la gente para reportar eso. Cada vez que reportaba algo, me ponían en el bus para mandarme para México. Gracias a Lizbeth, comenzó a hacer noise, como escándalo, para que se dieran cuenta de lo que estaba pasando. Entonces ellos me bajaron una vez del bus, ahí mismo en adelanto, pero la segunda vez me mandaron hasta la frontera. También les voy a dejar saber esto. Me mandaron hasta la frontera. Como ellos comenzaron a mover, pararon mi deportación. Me trajeron para atrás de la frontera de Tijuana, de San Isidro. Me trajeron para atrás, para adelanto. Pero ellos, por enojados que estaban, de adrede, ellos sabían mis enfermedades que yo tengo crónicas. Pero de adrede, lo que hicieron ellos, me metieron en una unidad donde ya estaba el contagio, para que me infectara y me muriera. Esa fue la intención de ellos, del coraje que ellos tenían.
Yes.
Porque todo lo que reporté, y sí lo lograron infectarme, pero gracias a Dios no me morí. Gracias a Dios no me morí, pero ellos de adrede me metieron en una unidad donde ya estaba todo infectado. Entonces yo inmediatamente me infecté.
Gracias, Jose, por compartir. Jose mentioned that he was at risk of being deported multiple times because he was facing retaliation when he would speak out. We would always put out audios from inside. And at one time, like I mentioned before also, he was taken all the way in a bus all the way to the border to be deported. But because of the actions and community support, he was brought back, and he stayed in the detention center for a little bit. He did mention when he came back, they put him in a unit with others that had COVID-19, so he did get infected. But he said, thank God he's alive today, and he's okay. But just wanted to highlight that form of retaliation, right? And that the Mexican embassy was somehow involved as well. So there's a lot of advocacy that can be done for cases like Jose. So thank you.
Thank you so much. Arlette, I know you also had a question.
Yeah, I just le quiero dar gracias a señor José por nos ir de su historia, porque es algo que no podemos decir, y es mucho del corazón que nos está diciendo su historia. So I just told our guest speaker that I want to say, thank you from the bottom of my heart that he's saying this. it takes a lot for someone to say a story. So I just wanted to say that. But my question for Lizbeth was, when it comes to family separations, and I just think back to the Japanese internment camp during World War II, and the U.S. government did actually give, you know, I'm thinking about the word, but money or like compensation after because of what had happened. Do you think that's possible after the family separation that happened in 2018? Has there been talks about this at all, or yeah?
Yeah, that's a good question. It is difficult because Japanese Americans were actually Americans and they were marginalized and put into these camps, right? People that are seeking asylum are not Americans. So it's difficult for us to advocate for reparations from the federal government. I think one way that we can get some form of reparations is by the government divesting from DHS and investing in community-based programs. So in the future, we're able to provide support for these families that are coming in. That's an interesting question. It's just really difficult to think about it when immigrants that are seeking asylum or in detention centers are not considered citizens. So it's difficult to even get funding for undocumented people in general. So I do feel a way that we can advocate for reparations, like I mentioned, is to ask the government to establish a model that is alternative to detention centers.
Thank you. I know we have some more questions from our attendees. One of our attendees asks, do you think that this mistreatment is sort of a way to warn, but also create fear for future immigrants that want to migrate here into the US? Do you think that this is sort of strategies to create that fear?
Yeah, it was definitely a way to create fear in immigrants that were seeking asylum. When we're talking about immigrants at the border, I feel like what's missing from the conversation is that people fear for their lives in their country so much that they're willing to make this journey despite the threats that this government has made. They have faced trauma in their countries. Even in Mexico, as they're trying to apply for asylum in Mexico, they face many uncertainties, and sometimes the only solution is to come to the States. So yeah, there's fear on both sides from the US government, but they also fear for their lives. So me as a parent thinking about what I would do to make sure I'm safe with my baby, I would do anything, and I wouldn't care if someone would tell me that it's a dangerous journey. I would do it without thinking about it twice. I also do think that I mean, the fear tactics did not start with Trump, right? Like we've mentioned before, it had already been happening with people that had been residing here in California for a very long time. ICE going into our communities and arresting people, essentially just kidnapping them in broad daylight, or in the morning or in the night, right? Going into their homes while they were sleeping and snatching them up. So this has happened over a long period of time, not only for asylum seekers, but people that have criminal records or that have some type of immigration status, but lose it because of a mistake that they've made in the past. So it's definitely something to think about, and how we see fear tactics that, as I mentioned, rooted in white supremacy, as always, used to marginalize people of color.
Thank you. We have another question from our attendees. They ask, children in detention centers are being assaulted in various ways, as you had mentioned, physically, emotionally, and sexually assaulted. How can we hold perpetrators accountable for their actions?
Yeah, like I mentioned before, through lawsuits is a good way to hold these perpetrators accountable. A lot of work needs to be done. Here in California, recently a bill was passed, AB 3228, that allows people inside detention centers to sue private contractors like GEO when these allegations or when sexual assault happens inside. So like legislation like AB 3228 at a federal level would give even more ability for people that are victims to sue, right, and to hold perpetrators accountable. Also through legislation, like I mentioned, but I think a good way would be to not giving these folks and private contractors and staff a platform, right? Stop giving them contracts to hold more children. It's like it doesn't make sense for the government to continue giving funding and contracts to these companies if they have a long track record of abuse, but it continues to happen. So a lot of work needs to be done to hold these folks accountable.
Thank you. And I know Vivek also has a question. Vivek, do you want to pose your question?
Yeah, before I start, Jose, gracias por tus palabras. I said, thank you for your words. It's really important to hear that account. Lizbeth, I wanted to ask, LGBTQ plus immigrants inside detention centers have stated that COVID-19 has intensified difficult situations to escape harassment and violence. According to a 2017 Center for American Progress analysis, LGBTQ plus people are 97 times more likely to be victimized while in detention than other detainees. Can you explain some of the ways that this pandemic has magnified these vulnerabilities, specifically for LGBTQ plus immigrants inside those detention centers?
Yeah, thank you for asking that question. I feel like oftentimes the LGBTQ community is forgotten, but inside of the Adelanto Detention Center, we have received reports of, in particular, GEO staff harassing folks. And obviously this pandemic has increased that, not only like risks to their health, but also to harassment. ICE has tried to mitigate like sexual harassment and verbal harassment towards these folks, but it's not enough, and it's not very clear. So a lot of work needs to be done in terms of that and holding these folks accountable. But I think through our networks and through mutual aid funds like the ones we have, we're able to support and prioritize these folks and get them some type of support, mentally, emotional support. So we definitely do take that into account, making sure that these folks that are even more marginalized than other folks, right, that receive priority access to some of the resources that we have. But yeah, I do agree that mental health is like a priority, and in Adelanto they have a long track record of having inadequate access to mental health. And one of the things that we've seen with folks that have mental health illnesses, and even LGBT folks that are going through a lot of mental health issues because of the harassment, are given unnecessary medication. And some of the reports we got were very alarming, in that medical staff and psychiatrists were giving them like sleeping pills so that they can sleep all day, and they wouldn't eat, and their health would deteriorate. So yeah, I mean, it's very extreme what happens. One way that we can kind of mitigate that right now would be to make sure that there's access to medical health and mental health support. But obviously, it's very hard to do that when we're talking about agencies like ICE and having access to the detention centers.
Thank you. Andrea, I think, has the next question for you, Lizbeth.
Well, first of all, I did want to, first, I'll just take a quick moment to thank our guest speaker, Jose. Jose, le quería dar las gracias, igual como nosotros le hemos estado dando. Toma mucho valor decir su historia, como lo que usted hizo, el escándalo ayuda. Las voces son poderosas, y le quiero agradecer mucho como hija también de inmigrantes, familia de inmigrantes. Yo también he tenido gente en familia detenida y las historias que me dicen son horríficas, es algo doloroso y traumático igual. Entonces sé que es algo vulnerable exponerse a decir estas historias, pero le tenemos que dar gracias y es lo que uno tiene que hacer, decir sus historias y compartir para que sigamos abocando para justicia, ¿verdad? Entonces, muchas gracias. Okay, so my question for Lizbeth, I do, Jose did mention earlier that a lot of them just speak their native tongue, right? So you did mention that there's a population, a big Haitian population. I was wondering, or even like there's other languages that aren't as, there's not that population. Like for example, Haitians, how do they communicate if they're only speak their native tongue? Is there any way to translate, anyone to translate for them? How is it that they get to communicate?
Yeah, that's a good question. I will say that in Adelanto, they do have a federal court when they have their hearings in Adelanto, and when that happens and they speak different languages or even dialects, the federal government is responsible for finding a translator during the hearing. So that does happen, but inside the detention center on a day-to-day basis is a whole different story. And I'll pass the question to Jose. José, Andrea está preguntando que hablaste sobre de las personas que hablan diferentes lenguajes. ¿Cómo es la situación adentro para ellos y cómo se comunican? Está preguntando si se pueden comunicar con el staff o cuál es la situación con las personas que hablan diferentes lenguajes que inglés.
Pues es muy duro para ellos, ¿me entiendes? Porque lo que yo hacía, como había gente de Armenia, usted conoce a Ana, ¿verdad? La rusa. Ok, ella le puede decir, yo le tenía que llamar a la Ana para que me traduciera con ellos. Los ponía en el teléfono con Ana. Como la Ana habla rusa y armenio. Entonces ella me ayudaba a comunicarme con ellos, qué necesitaban, en qué los podíamos ayudar. O si no, a señas. Porque si nosotros le preguntamos a los securities que necesitaba esa persona algo, decían que no había nadie que pudiera comunicarse con ellos.
Yeah, so oftentimes people detained did their own work to support each other. He would actually call someone that was detained there too, a woman. He would call her and ask for her to translate documents either in for Russians or Armenians that were detained, or they would speak to each other with hand signs. And when they would ask the security guard for help, the security guard would say like, well, I don't speak the language, so sorry, I can't help you. So that was the situation with the languages.
Luego, otra cosa, hubo mucha discriminación cuando el juez dio la orden para que llenaran un documento, para llenarlo, para poder salir, como salimos mucha gente en parole, que era la orden del juez. Nomás lo pusieron en inglés y en español y en chino. ¿Qué pasó con la gente de Armenia, con los indios?
Yeah, so they saw discrimination recently when the judge ordered releases. They had to fill out a document, but they only had it in 3 languages, Spanish, English, and Chinese. So folks that were from other countries like Haiti, Cameroonian folks, Armenia, Indian folks that are some of the higher populations in Adelanto did not have access to translation for the documents. Therefore, it meant that it might delay the release. So it's very impactful to not have translation inside the detention center.
Y otra cosa, cuando salió la pandemia del coronavirus, CDC mandó folletos para ponerlos en la pared, para tomar precaución cómo poderte lavar las manos o qué hacer. Nomás lo pusieron en un lenguaje en inglés.
So he's saying another issue was that when CDC set guidelines to stop the spread of COVID-19, they printed out flyers or educational letters to post throughout the detention center, but they were only in English. So mostly everyone that spoke Spanish or another language was not able to understand or educate themselves on the virus. Gracias, Jose.
Thank you for, again, giving us a more insightful perspective. We do have a question from one of our attendees as well, and they're asking about sort of the narratives that are coming out of, various places, right? People, websites that detention centers are being safe and that they are sanitized, or that, detainees, quote unquote, sort of over exaggerate and are spread across millions of people. Where do these narratives originate from, and how do we change them?
Yeah, I think that ICE and private prison companies like Geo Group do a really good job of spreading propaganda and like spreading their own narrative. So a very good way to combat this and put out the truth is by uplifting stories like Jose's. And it's so important to do that in spaces where policy is being created, right? To inform policy, to inform legislation. And so I would just continue encouraging folks to connect with people inside, or to listen to the stories that we're putting out of folks that have been detained, that have lived through it. Those are the real stories and the truth that we try to verify, right, through lawsuits, through other means. But we want to take the truth and shed light to the truth by uplifting these stories. So that's definitely something I always try to do. That's why I brought Jose here today, so that he can speak to you all, and it's coming from a firsthand account, right? All of this was also proven through many of the lawsuits, through all the documents we found. So definitely we will continue doing that work and bringing exposure to these stories and changing the narrative that is currently happening.
Yes, and I have to agree with you, right? Bringing these voices into the table, into this decision-making process is really, really important, because oftentimes, the ones who are making the policies and putting forth, the legislation are not the ones experiencing that, or do not know of what's going on. And so putting those voices into light and really highlighting the experiences is really important, as you had mentioned. And so bringing Jose here is an example of that, right? Of being able to really recall the things that are the mistreatment that is happening, and what we can do to mitigate this and to combat this. So thank you. Our attendees, these questions kind of mix together, but they're really wondering, Susie Morales and one of our attendees is really wondering, how can one become involved in ICIJ? Do you offer any remote internships? They really want to know if they can get involved with the org and the coalition.
Yeah, we do have internships available. You can reach out to ICIJ through info@ic4ij.org. Again, I'm gonna put in the chat, maybe that's helpful. For an internship. And then other ways to get involved, like I mentioned, is signing up to be a first responder with the network. Also, I would invite folks to join our event in March, on March 28th at 12 p.m. ICE on Trial, so that you can learn more in specific and know about the reports and hear more stories. Like Jose, we're going to have more folks there. The judges panel will have a doctor, an attorney, and other folks that will be examining and going over these testimonies and reports, and then have a judgment on ICE and in this tribunal. So I encourage folks to join that as well. And then there'll be follow-up after that. You can also join our listserv. So I'll definitely leave that on the chat.
Thank you so much. Yes, there are ways to definitely get involved, right? Be a part of the conversation, be a part of the movement is really, really critical. And I think that those were some of the things that we highlighted here in this webinar. But unfortunately, that is all the time we have for questions today. I would like to once again thank you, Ms. Aiblin and Jose, for generally spending time with us today. And thank you to all who attended today's webinar. We really appreciate it. Our next installment of the UCR School of Public Policy seminar series will be this Thursday, March 4th at 3:30 p.m. Pacific time with Marisol Franco, Director of Policy Programs for the Women's Foundation California. And she will be discussing the economic disadvantages women face within the context of poverty. But of course, you can learn more about events like these by visiting spp.ucr.edu. Thank you again, Lizbeth. Thank you again, Jose, and we will see you all at the next event.